Welcome to the Deep Dive. Today we're taking a look at something really fundamental, actually. The quality and safety of our healthcare.
Yeah, it affects everyone.
Absolutely.
Yeah.
Think about when you walk into a hospital or clinic, that feeling of security you hope to have. It doesn't, just happen by accident.
No, definitely not. It's built on layers, really.
Yeah,
Dedication, rigorous standards, and that's what we want to unpack today.
exactly. We're exploring how these organizations actually strive for and then show these high standards in, well, really critical areas.
And we've got some great material to guide us. We've pulled information from Joint Commission International, JCI.
Right? The global player.
Yeah, and also the National Accreditation Board for Hospitals and Healthcare Providers, that's NABH, focusing on India.
Okay.
Then there's ISQA, the International Society for Quality in Healthcare, more about global collaboration.
Got it.
And to make it really practical, we're digging into a transcript from the QI playbook. They were talking about tools like process mapping and value stream mapping, plus some other texts on that too.
So the mission today is really to understand what roles bodies like JCI and NABH play, setting those benchmarks.
Right, and how ISQA helps everyone work together internationally.
And then get into the real nuts and bolts, those practical tools, the mapping techniques healthcare organizations are using on the ground.
Exactly. Should we dive in?
Let's do it. Okay, JCI Joint Commission International. You hear that name a lot with global healthcare quality. What's their core mission, really?
Well, they are definitely seen as a global leader. Quality of care, patient safety, that's their focus. Their mission is pretty clear: to enable and affirm the highest standards of healthcare quality and patient safety for all.
For all. That's a big goal, isn't it? Especially with healthcare systems varying so much worldwide.
It really is. And their reach is quite something. They work with organizations in, over 70 countries? Asia, Europe, Middle East, Africa, Latin America.
Why not?
Yeah, accrediting and certifying, I think, over 1,000 programs. That's a serious footprint. It impacts care you or I might get almost anywhere.
And what are the hospitals themselves saying? Does it actually make a difference beyond, having a certificate?
That's the interesting part. We've got some quotes from leaders, and they really talk about tangible benefits. Like Alex Lon from Hong Kong Adventist Hospitals, he called JCI accreditation one of the best team-building exercises.
Team building. Interesting.
Yeah, said it improved coordination, communication across departments, which, when you think about it, that internal efficiency has to translate to better patient care, right?
Makes sense. It's not just ticking boxes for an external body. The process itself improves things internally.
Exactly. And Shija Kurian at Burjeel Farha Hospital mentioned how it strengthens community trust and helps them manage risks better, building that culture of patient safety.
Yeah, it's what we all want, ultimately.
Absolutely. Imad Sadiq from Emirates Hospitals Group talked about adding real value, boosting patient confidence. And Roxana Fulton at Corniche Hospital, they got their gold seal for the 6th time. That shows it's not a one-off thing, it's this ongoing commitment.
Right, continuous effort.
Yeah.
So JCI offers more than just the accreditation stamp itself. What else is involved?
Oh, yeah, definitely. They have different accreditation programs, even specialized ones for things like telehealth and healthcare sustainability certification. Thinking ahead.
Sustainability, okay. That's forward-looking.
It is. Plus, advisory services, helping organizations prepare, improve quality management, infection prevention, medication safety, all crucial areas.
And the standards themselves, like those patient safety goals.
Yes, their international patient safety goals are foundational for many systems. They also publish resources, books, guidelines, the JC Insight newsletter, offer webinars.
So lots of knowledge sharing, too.
Very much so, really promoting best practices. They've even got a conference coming up, Unify 2025, focused on solving healthcare challenges. So driving innovation, not just maintaining standards.
Okay, so JCI, big international player, setting global standards. Now let's switch gears slightly to NABH, the National Accreditation Board for Hospitals and Healthcare Providers in India. What's their main focus?
Right. So NABH is part of the Quality Council of India. Their main job is setting up and running accreditation programs specifically for healthcare organizations within India.
Ah, so tailored for the Indian context.
Exactly. The goal is really about meeting the needs of consumers there and setting benchmarks for the Indian health industry. So while JCI has that global view, NABH is deeply embedded in the Indian system.
I see. So the standards might be different or applied differently compared to JCI's international ones.
They'd be designed to be relevant and effective within India's healthcare landscape. It's interesting. They get support from stakeholders, industry, patients, government, but they operate with functional autonomy.
Meaning they're independent in setting standards.
So that's the idea, yeah.
Hmm.
Ensuring independence in defining what quality looks like for care in India.
They talk about creating an ecosystem for quality. What does that look like in practice for someone needing care there?
It means they're not just accrediting one hospital here, another there. They're trying to build a whole culture of quality improvement across the system. They offer tools, too, like a digital health toolkit, info on accreditation benefits, the standards themselves, making it easier for organizations to aim higher.
Which should lead to better, safer care for patients.
That's the goal.
Okay, so we have JCI and NABH focused on accreditation and standards. What about ISQA, the International Society for Quality in Healthcare? Sounds like a different angle.
It is, yeah. ISQA is member-based, not for profit. They've been around for over 30 years, promoting quality improvement worldwide. Less about direct accreditation, perhaps.
So how do they promote quality then, if not mainly through accreditation like the others?
Their approach is more focused on education, sharing knowledge across borders, supporting external evaluation through their IEA arm,
IEA.
International External Evaluation Association, and also strengthening health systems, connecting professionals globally. Think of them as a facilitator, a hub.
A global community for quality improvement.
Spot on. Their network covers over 70 countries, 6 continents. They bring people together.
Like with conferences.
Exactly. They have the São Paulo 2025 conference coming up. The theme is Inclusive Health Systems, Navigating Challenges with Technology and Humanity. These events are crucial for sharing the latest thinking.
And do they have resources like JCI?
They do. Journals like IJQHC and IJCOMS, green and white papers on patient safety, educational programs like a fellowship program.
So building expertise in the field.
Yes, very much focused on disseminating knowledge, building capacity. The idea is that improving quality is a shared effort, and giving professionals the tools helps everyone, ultimately the patient.
Okay, this makes sense. We've got the standard setters and the global connectors. Now let's get practical with these tools. Process mapping and value stream mapping from the QI playbook. They sound a bit technical.
They can sound that way, but the core idea is actually pretty simple and super useful. Process mapping is basically just drawing a picture, a visual diagram of all the steps in a workflow.
Like a roadmap for a task in a hospital.
Exactly, from start to finish.
So why is that helpful for me as a patient? What does visualizing it achieve?
Well, when you see it laid out, it makes it much easier to spot the problems that affect your experience. Redundancies, doing the same thing twice. Bottlenecks, where things get stuck and cause delays, those long waits. Unclear handoffs between staff, which can lead to mistakes.
Right.
Or just steps that they don't actually add any real value for you.
That makes a lot of sense. The podcast mentioned different kinds of maps. High-level, detailed.
Yeah. A high-level map gives you the big picture, the main stages, good for initial understanding, like the main steps in an ER visit.
Okay.
A detailed map dives deep into each stage. That's what you need when you're hunting down the exact cause of a problem, like why registration takes so long.
And swim lanes.
Swim lane diagrams are great when lots of different people or teams are involved. It clearly shows who does what at each step, helps avoid confusion, ensures accountability, smoother care for you.
The podcast used that OPD patient registration example. Could you walk through that again? How does mapping reveal the issues?
Sure. So you arrive for your appointment. The map might show. Arrive, wait for a token, fill a form, show ID, wait again, clerk types in data, confirmation slip.
Sounds familiar.
Right. Mapping it might show, okay, lots of manual steps, paper forms moving around. Maybe the same info gets entered multiple times, increases error risk, definitely causes delays. Frustrating for you.
It really shines a light on the snags.
Right.
Okay, so how is value stream mapping VSM different? The podcast said it goes further.
It does. Process mapping shows all the steps. Value stream mapping focuses on which steps actually add value from your perspective, the patient's perspective. And it specifically calls out the waste.
Waste.
Yeah, it comes from lean thinking. VSM adds layers.
Yeah.
Time per step, waiting time between steps. Is a step value added or non-value added? Where are the delays?
So it's not just the what, but the how long and is it worthwhile for each step I experience.
Exactly. VSM helps teams answer. Where's the waste in this process that doesn't help the patient? Waste can be waiting, errors needing fixing, doing unnecessary things.
The diagnostic test example in the podcast was interesting. How does VSM show waste there, especially in stuff I don't even see?
Right, so doctor orders a test, nurse collects the sample, maybe 2 minutes. That's value. But then the sample sits waiting for 20 minutes, no value there.
Right.
Porter takes 5 minutes, reaches lab in 3 minutes, then waits in a queue for 30 minutes. more waste. The test itself runs for 10 minutes value, report generated in 2 minutes value. But then maybe the doctor doesn't see it promptly because of shift change or something. Delay, waste.
Ah, I see.
VSM makes it stark. Maybe only 17 minutes of that whole time actually adds direct value to your care. The rest is waiting, transport, queuing, waste that could potentially be cut to get you results faster.
That's powerful visualization. So when does a team use process mapping versus VSM?
The podcast analogy was good. Process mapping is the blueprint. Use it first to just understand how things work now.
Okay, step 1.
VSM is like the efficiency audit on that blueprint. Use it when you're ready to optimize, especially using lean ideas or where time is really critical for patients.
Like the fictional example they use about reducing hospital discharge times, that wait can be long.
Very relatable. Dr. Neha Bala, fictional, yes, but a good example, used VSM on their 14-step discharge, found a huge delay, sometimes over 2 hours, just between billing finishing and pharmacy getting the meds ready.
Wow.
Physical paperwork, lack of instant communication, they put in a digital notification system, cut discharge times by 90 minutes on average.
Wow. Just from visualizing the value stream and finding that bottleneck.
Exactly. Shows how it can lead to practical solutions that really improve your experience.
And what were the key takeaways for teams using these tools?
3 main things from the podcast. 1, involve the whole team, get all perspectives.
Right.
2, walk the process. Follow the patient journey, see it firsthand, you spot things you wouldn't otherwise.
Makes sense.
And 3, aim for progress, not perfection. Start with a useful map, refine it later, don't get bogged down. Oh, and the bonus tip. Use sticky notes or digital tools to make it collaborative.
Good tips. So just to summarize the difference, Process Map shows the steps in my journey. VSM adds time and value to find the waste impacting my care. Can they be used together?
Oh, absolutely. That's often the best approach for real improvement. The supporting text highlights this too. Process mapping looks closely at specific tasks, right? Narrower scope. VSM takes the bigger picture end to end. The whole flow of value from when you first interact all the way through, focusing on what benefits you.
The table we have lays that out clearly. Scope, focus, detail, goal. Different tools for different jobs.
Exactly. And the synergy is key. Use VSM to find the big problem areas in the patient journey, the where. Then use process mapping to drill down into those specific areas and figure out the how, which exact steps need changing.
So VSM finds the target, process mapping helps aim.
Nice way to put it. Leads to better team communication, data-driven decisions, maybe even using process mining for deeper insights into patient flow.
So VSM gives the strategy, process mapping refines the tactics.
Precisely. And it's happening in the real world. The podcast outro mentions Supremediq consultancy using these mapping tools in their work, even helping with NABH accreditation. It shows these aren't just academic exercises.
No, practical tools for improvement. This has been really illuminating. It's clear there's a lot going on behind the scenes to ensure healthcare quality and safety.
There really is. We've seen accreditation bodies like JCI and NABH setting essential standards you can trust. JCI with that global perspective, NADH tailoring it for India's ecosystem.
iSquaw playing that crucial connecting role, sharing knowledge across borders, so improvements spread.
Definitely. And then the practical tools like process mapping and VSM give teams the power to look closely at their own work, find those inefficiencies that might affect you, and make things better.
It really drives home that great healthcare isn't just about skilled individuals, is it? It's also about well-designed systems that are constantly being improved.
Absolutely. Systems that focus on efficiency, safety, and the patient experience at the end of the day.
It makes you think, doesn't it? Consider any healthcare process you've been through, maybe just getting a prescription or a checkup. Where could mapping those steps and really asking what's the value here lead to improvements?
Yeah.
Even for your own experiences next time.
That's a really interesting thought to leave people with. Where could mapping make a difference in the care we all receive?